Hi, my name is Megan Hill. I'm from the Harvard Project, and I'm here with my colleague, Stephanie Carroll. Stephanie, would you like to introduce yourself for us?
Sure, thank you, Megan. Sidak Atnakistan, Sidak Stephanie Carroll. I'm Stephanie Carroll. I'm Atna from the native village of Kludika, and I'm Associate Director for the Native Nations Institute in the Udall Center for Studies in Public Policy and Assistant Professor of Public Health at the University of Arizona.
It's so great to have you here today. I understand that you, Desi Rodriguez-Lomber, Randy Aki, and Nicholas Barcelo recently had an article accepted for publication in the Journal of Public Health Management and Practice about the distribution of COVID-19 on reservations in Indian country. And so I'm wondering if you might be able to tell us a little bit about the article and your findings and really what this pandemic looks like across Indian country.
Sure. So one of the most striking findings was that we found that the rate of COVID-19 cases per 1,000 people on reservations is more than 4 times higher than the United States as a whole. And we know that the outbreak in Indian country on the surface mimics how outbreaks occur in general. So we have hotspots such as the Navajo Nation and for Indigenous peoples in New Mexico right now. While we also have had hotspots in New York City and New Jersey, where these case rates are much higher than other places in the country. In Indian country and elsewhere, we also see these kind of super spreader events where people gather together for religious, social, workforce reasons, and those catapult infection rates. But the hallmark of difference for Indian country is that you often have an outbreak in a community that already lives with economic, housing, and food security issues and healthcare access challenges. So an outbreak such as COVID-19 further stresses these communities. Tribes have been taking extraordinary sovereign actions to protect their communities. They've closed their borders, they've issued stay-at-home orders, and they've collaborated with other governments, community groups, nonprofits, and universities to meet the needs of their citizens.
Great. Can you maybe speak to some of the factors that are contributing to this in Indian country?
Our research found that by April 10th, so this is the early days of the pandemic, COVID-19 cases were more likely to occur in tribal communities with a higher proportion of homes lacking indoor plumbing. And these cases were less likely to occur in tribal communities where households spoke English only. And so the coronavirus exposes the systemic racism and colonialism that's endemic in the US. And for public health in Indian country, these differential investments in public health infrastructure over the past 30 years come into focus, where we have a very Western approach that privileges, obviously, English language, but also the differentially funds public health in Indian country. So while we've seen growth in tribal public health capacity across the country, our systems in general require investments in everything from household plumbing to epidemiological capacity to robust tribal public health codes that reflect our own values.
So given this from a public health point of view, what actions do you think can be taken by tribal governments to manage the crisis and safeguard their citizens? You had mentioned stay-at-home orders. Is there anything else?
Sure. From our research findings, we want to speak to ensuring potable water and then making sure that we have culturally relevant, timely information that's communicated via community preferred media. So whether that be radio or somehow household to household, we need to re-envision these in ways that are our own ways and make sure we're communicating in our own relationships. But there's also implications for building relationships, right? For supporting community groups that are providing for our vital necessities, for using robust data sharing agreements that at the same time uphold tribal sovereignty and make Indigenous peoples visible in state and local and national data sets, and access healthcare personnel and supplies through collaborations with universities, states, and hospitals. I think some of the other things that we really want to make sure to underscore is that we need to rely on our cultural teachings and knowledges. And the hope is that we care for our people now and are better prepared for the next unexpected or low probability high risk event that occurs. So finally, we desperately need funding, right? So we need to have the provision of urgent funding to strengthen our tribal public health and household infrastructures now and into the future. We need the CARES Act funding to come down to Indian country today. And so we need to be able to both do it our way as sovereign nations, but also receive the support from our greater communities.
That's a really good point. When is the journal article going to be published?
So the article will be published in a special issue focused on COVID-19 that will publish in July.
Great. Well, Stephanie, I know you're busy. Thank you so much for your time. For more information, please visit the Native Nations Institute. The link's right below. And look out for the July 2020 issue of the Journal of Public Health and Management and Practice. So thanks so much.
Thank you, Megan.